health. Rotarian Kirit Mistry is the chair and founder of South Asian Health Action Charity. He is the campaign developer. Hindus, Sikhs, and Muslims embrace organ donation awareness campaign. He is the ambassador of NHS Blood and Transplant, NHSBT, and organ donation for the Midlands. He is the charter member of the Rotary Club of Organ Donation, UK. He was the President Rotary Club of Organ Donation 2023-24. According to Rotarian Kirit, I quote, "My mission is to improve health equity, advocate for inclusive healthcare solutions, educate on diabetes prevention, and promote organ donation within diverse communities." Rotarian Kirit is driven by a clear vision and mission to improve health equity within South Asian communities, to advocate for healthcare solutions that are culturally sensitive and inclusive, to raise awareness and educate on diabetes prevention and management, to promote organ donation and increase donor registration within diverse communities. Rotarian Kirit's tireless dedication to health advocacy has earned him numerous accolades, establishing him as a highly respected and influential figure in the field of community empowerment and healthcare equity. Thank you, Rotarian Kirit, for being speaker on today's topic, Rotary clubs and organ donation. Over to you. Thank you.
Namaste to all the members.
Okay, Kiran Bhai, you have to change your position. Yes, please go ahead.
Okay, so namaste to fellow Rotarians for the Rotary Club of Organ Donation International and other colleagues who are listening or tuned in on your YouTube channel. Thank you for the kind introduction, for giving me Rotarian Ruby Agarwal and also fellow colleagues from the Rotary Club. So it's been a pleasure to have connected with Rotarian Gulal for the last year or maybe a bit longer in terms of doing the fantastic work of what he's doing with your club in India and internationally. And I was hosted him in the UK on his previous visit to try and connect the Rotary clubs in Leicester and other NGOs to look at how we can work together to address the shortages of organ donation, particularly coming from the South Asian diaspora communities, but also important of organ donation to save lives, because it's not just our communities, it's all communities who need to be ensuring that they help spread the message of organ donation, and also helping their loved ones who are looking for or indeed need of a transplant. This is one of the campaigns that we try and do in the UK to ensure our communities get better awareness, but also better engagement by the institutions. But most importantly, the lack of awareness of or the mentality about we only talk about donation when we need an organ ourselves, rather than trying to look at how we raise awareness and making sure that. And fortunately, in May 2020 of this year, of 2020 of May, the law changed in the UK where it's an opt-out system, so people are already opted in, and that proved a challenge, because when the opt-out law came in, when the law came in, it was a sudden surge of communities, particularly from the South Asian communities, deciding to opt out because of the misinformation that was being portrayed in social media. And we're now trying to tackle that misinformation by ensuring we get the right messages out there, that it's still, although we are automatically going to be organ donors, your loved ones, your next of kin has the right to honor your wishes, but they will be consulted at that time, and they would then have the final say. So we're creating conversations on organ donation within families to make sure that they honor their loved ones' wishes, and to spread our message of the Rotary Club of Organ Donation and the Rotary Club Organisation UK in terms of our message around no one dies waiting for an organ transplant. So that's our kind of key mission, to drive that message. And Rotary, what better movement to do it with? The Rotary, because Rotary clubs exist across the world and they are there to promote various causes. And we're fortunate that we have started to work with Rotary and specific clubs for organ donation, spread our message, and this is where we have to collaborate. And thankfully, we signed an MOU recently, last month, to do some more joint collaborative work with the Rotary Club of Organ Donation International and the Rotary Club of Organ Donation UK, because we can share, learn from each other's fantastic work around the message. And obviously, when the statistics, the evidence, the research, it's really important to kind of make sure that we get this information into the lay communities, because otherwise they would not get the information, and we need to ensure we do that. My final words really look at how we work from the UK context and what can we learn from the India and the global context around what's going well around organ donation, and what can we replicate in the UK, and what can we share from the UK in terms of good practice to the global context.
Open my video.
Just hold on, please. I will just one moment, please.
Continue.
Yes, please continue. Kiratji, please continue. Rotarian Kirat Mistry, are you there?
Can you hear me?
Yeah, but we can't see your video. Yeah, now it is okay. Yes, please go ahead.
Okay, so as I was saying, this is a great opportunity for us to look at how we, from the Rotary Club Organisation, we're a new club that we are now trying to charter. So we have, at the present, we have 13 members. Once we reach 20 members, we'll be chartering our own club. And that's what we want to then look at, how we charter clubs in the UK context of England, Scotland, Wales, Ireland. And working with the Rotary Great Britain and Ireland, that's our main working collaboratively with our Rotary Club of Great Britain and Ireland, who are actually situated in those.
One moment, please. Someone is. Who is that? Please mute. Please mute. Keep yourself mute. Yeah, I am muted. Correct. Please go ahead. Please go ahead. Sorry, Rotarian Kirat.
No problem.
Please go.
So if we've got through your contacts and connections in the UK, then we would certainly welcome to connect with them to kind of help look at chartering clubs of organ donation in the nations that we are trying to do. And again, we have fantastic team. Currently, our members are physicians, nephrologists, transplant surgeons, and recipients and communities as well. So we've got a fantastic members who have signed up. We're now trying to charter the club, and we hope to charter it by the new year. So we would launch it in the new year of our official charter club. But then also looking at the strategy of how we work in the nations of England, Scotland, Wales, Ireland. And one of the things you mentioned in your opening introduction was one of the key challenges that we faced early on was organ donation from a faith perspective. People were using religion as the basis of donation can't take place. So we had to then develop specific campaigns for different faiths. So we developed a Hindu, a Sikh, and a Muslim campaign to try and address the challenges around, reuse religion, but trying to make sure that religion doesn't say you can't save lives. So that's the kind of messages that we were trying to ensure, that if there is religious doubt, then yeah, we speak to the religious scholars, but most importantly, in our holy books, there's nothing written that you shouldn't save lives or you can't donate organs. And that's kind of where we have to keep the message going in terms of any of the faith communities that we are working with. we need to ensure that. And my message is simple. It's not, so let's put religion to one side for a minute. But you or your loved one need an organ, would you take it? And most of the people say they will take the organ. So then religion doesn't come into it, because somebody's had to die to give you that organ, or somebody from your family has stepped forward to donate, being a living donor. So I think we can do some fantastic work from the Indian context, the global context, and the UK context in terms of how we address some of the myths and taboos of organ donation from a cultural and a religious point of view. I think I'd like to just stop there and kind of engage in any questions or and further dialogue, really. So thank you for the kind invitation.
Okay, thank you very much, Rotarian Kirat Mistry, for giving your time, although I know that you are quite busy, but because it's a very, very important topic today, what we have taken is Rotary clubs and organ donation. See, what happened, my experience says, because first of all, I would like to inform the members as well as the viewers who are watching our show that I know Rotarian Kirat Mistry for now more than a year, and he invited me, although we never met, but he invited me to address the Rotary Club of Leicester in UK. And there, after that, I personally visited his office in Leicester, and I found that how dedicatedly a person is working for the organ donation, for diabetes, for all other things related to health. And that's why our relationship become more and more strong day by day. And then he informed me that he has already formed a club called Rotary Club of Organ Donation UK, and how we can go ahead with among ourselves. So we decided to sign an MOU, which we have signed on in this, I think, the first of this month or second of this month only, and in which it was very, very clearly written that we are going to promote the organ donation among ourselves, among the Rotarians, among the society at large in UK, India, and internationally. Now, Rotarian Kirat Mistry, you very well know that whatsoever we say, but still the Rotarians themselves are not aware about organ donation. At least in India, I have found, I am sure that you might be finding the same way in UK and USA. They know what is organ donation only by nomenclature, but otherwise, if you ask them, their first thing is the eye donation, because the eye cornea, they consider it as an organ donation. And we know very clearly that eye can improvise the life, but it cannot save the life. And to save the life, we require organs, not the tissues. Tissues are also very important, but organs are very important. So I was just wondering whether like you said, how we can go ahead together. The first aim is to enlighten the Rotarians, because we have a very big family all across the world. So if we can enlighten them by addressing them, by inviting them to come and come to join our meetings, although to be very frank, I found that that much interest is not there, because there is at least in our case, it's a virtual meeting. It's on and the Rotary's first motto is the fellowship, which we can't provide on this thing. But still, people have taken more interest now listening to us. Today only we had a program during the afternoon of the 100 days completed by the district governor this year. And he was celebrating, because our district 3141 is a leader in many ways, especially for the TRF funds, etc. They are the #1 in the world, not only in India. They invited all the presidents, and they were all celebrating. And there I found the change. The people wanted to know about organ donation. They wanted to invite me or other speakers for their clubs. So what I feel that Rotary clubs should do is to keep a programs more frequently, which they feel that once a month, once a year, or once in a 2 year, it will not serve the purpose. You require more frequent programs. Secondly, the main problem which we are facing in India is the funds. I know that UK is flush of funds, because your health system is a covered by NHS, and the organ transplants are covered by NHS, if I'm not mistaken. So when it is all covered, so there is no problem for a donor or a recipient to have the money. But here, the problem is, even somebody wants to donate, his problem is, or her problem is, whether the money, who is going to bear the expenses. Similarly, a recipient here, it's a very difficult situation. Even he or she might be number one on wait list, but the money, to organize the money within 4 hours or within very less time, it's not possible. Although now government of India has come out with Ayushman Bharat scheme and insurance companies are stuck, but still it's not that much. Do you think in this way we can jointly appeal to the Rotary International, like they have a polio and polio fund, similarly, and organ mortality fund, or something we can do so that they can also raise the funds and give the funds, foundation give the funds. What is your opinion about that, Rotarians?
So thank you for I think from Rotary, the work that we can do to get Rotaries and Rotarians to understand more about the organ donation. A great initiative that the Rotary Club Organ Donation, which I chartered, have done a Rotarian's guide from the Indian context. So it's a book that's been written by the Rotary Club Organ Donation, and again, that's one way of trying to get the Rotarians to understand better about the laws of organ donation and the importance within the Indian context. We want to do something similar from the UK context. In terms of another fund you mentioned, the Rotary Club Organ Donation, again, have, through the global grants, created a funding pot to provide transplant, medication costs post-transplant for particularly women and children in the kind of Bangalore area as a starting point. But again, that's only a small pot of funding where we support, where the club supports people who post-transplant need help with their costs of medication and support. But again, creating a fund like this, we should be creating a campaign to Rotary to look at that, because I think it's from the Indian context and in some of the other lower middle income countries where the costs are not bared by the government initiatives. We need a Rotary as a global organization to create a funding mechanism to support people or support Rotary clubs like yours, like ours, to ensure that there is a way of providing funds for people who are needing support post transplant, or even while they're going through transplant. There's costs that need to be bared and incurred. So we can only do that by mobilizing the Rotary International, the boards. We can do it from the districts, and then from the UK context, we are trying to do it from our Rotary Club of Great Britain, Rotary International Club, Great Britain and Ireland, because they are the board, they are the context of the UK. So we can look at how we can develop something around that. But most of the funding NGOs do as well. They fundraise through various charitable activities. So again, that could be one way of creating the funding mechanisms to help. So we've got to create a campaign first, and the campaign should be, based on the research, based on evidence, where we can start off from the Indian context to see why it's important to have a fund to help families, recipients who are actually, even donors who are needing that support for medical support, or even the support is not just about medical, it's a psychological support as well. So the mental well-being and mental health is also a key when people are going through transplant or waiting for transplant. That is not really that mental health support is missing. I know in India there's some good work happening with different hospitals who provide that, but that's another area that we need to focus on. So it's a good question. I think it's a good, if we can do a campaign, mobilize Rotary clubs around the world, and in countries where Rotary's, UK, USA, where there's more the philanthropical kind of context where there's easy to donate funds to causes. That's what we should be trying to reach out to. But also, Rotary would, from the foundation point of view, there are other Rotary clubs for different causes. So again, we need to do that research and gather the evidence of why should organ donation be, supported over and above some of the other causes that the club's already working on. So I think it's going to be interesting conversations we need to start creating, having a campaign and seeing how that campaign sits with Rotary International. And when it goes to the conventions, we need to ensure that there's a visibility of Rotary Club for Organ Donation at the conventions, to champion the cause. And that's what we should be focused on. Between now and the next convention, we should be building that momentum and trying to influence those Rotarian who are sitting on those boards to champion our cause as well.
Okay, thank you very much. Now it's open for everyone. Whosoever wants to ask a question, please feel free to ask the question. Rotarian Kirat Mistry will be pleased to give the answers. Whatsoever type of questions regarding Rotary clubs and organ donation, or even for organ donation, or if you want to know what is the condition in UK, whatsoever you want to know about the organ donation. He is a person who is having deep knowledge on this because his life is totally dedicated for this cause. Forum is open. Whosoever wants to ask, please ask. I think people are taking time to ask the question. Now, my second thing, which I feel is the message, because right now we have many Rotary clubs and Interact clubs all over the world. But to have a dedicated clubs for organ donation, we have one or two. But if we will start this as a chain, because what happens that the young mind, if we will catch them and we will put them in their mind that why the organ donation is important. As you said about that, we have to convince the Rotary International why it is more important. If you recall, in mid-80s, the polio was a havoc, and especially in the developing countries mainly. Today, almost last year, the very few cases were there. This year is a bit alarming because we already got 46 cases in Afghanistan and Pakistan together, which is a bit alarming thing. So that's why again Rotary International is again putting pressure off for the polio and thing fund. But otherwise, if you see the conditions of organs in India, especially, I'm talking of India because you know that in your UK right now, the mortality rate is very low in comparison to India. Last year, only 432 people lost their life in UK, while in India, the official figure says more than 5 lakhs. If we see the comparison of the population, yes, it is almost 1/20th time less populated UK is. But if you multiply 20, it is not even 10,000. So if one side 10,000 people are dying for want of organ, another side is more than 5 lakhs people are dying for the same number of population. There it shows there is something which we have to take care. And that what I could found in last 8 years when I am engaged in this organ donation campaign and creating awareness, that the two factors are very important. One is definitely the law, the legalities, the restrictions in India, because here you cannot donate organs to a non-related person unless the government gives the permission, which is next to impossible. While in the UK, I was told, I think in the last meeting when we had at Leicester, that a person can donate the kidney or the liver if he is fit to donate, and it will be added in the wait list and it will go to the person who is on the top. Is it correct, Rotarian Mystery? Can you just enlighten that?
Yes. So in terms of the list, the transplant waiting list that we have in the UK, the organ once available is then looked through the register, and whoever's has the tissue type, the blood type, will then be called to go to the nearest transplant center. But the priority, there is a priority of children comes first, and then those those who are in serious need, if they because of their health conditions, who will need that transplant. So again, it's based on that order. But I think the question is really, how do we ensure what we try to do in the UK is people are aware of the transplant list, but also where we have from a living donation. So if somebody's coming forward as a living kidney donor, we have a scheme, a matching scheme, where if you are coming forward to donate your kidney to your loved one and you don't have the right tissue type, blood type, you go into the matching scheme, and somebody else will then donate to your loved one, and your loved one will donate to somebody else. So that's kind of a scheme that's been developed over a number of years to ensure kidney transplants can take place for people waiting who don't have their loved ones matching for them.
What about the non-related? Suppose I want to donate my kidney as a donation. I'm not, I have no issues, means my family doesn't require kidney, but I feel that I must donate my kidney. I was told that in UK, I can approach the medical center and tell them that I am interested to donate my kidney, and they will say, okay, yes, you can donate the kidney if my health permits. Then they take the kidney and give it to the wait list. Is it correct?
Yeah, so that you can become an altruistic donor where you can donate. The person, well, you can go to the local transplant or the local hospital to say, I wish to be a donor, a living donor, and then that way you can make your donations happen. But again, you can't, in the UK, you can't decide who gets that organ. You're just altruistically donating to somebody on that waiting list who would need it as well. So yeah.
Yes. So there the real donation is taking place, because like if we donate money to a church or to a mosque or to a temple or a gurudwara, we know that we are donating something, but how the money is going to be used, we don't know. Similarly, in UK, you have the scheme where if I want to donate my kidney, I can donate the kidney, and how it will be used, that is not my concern, and I am not going to know where the kidney has gone. Correct. And I cannot put a condition that this money has to be used to give to so and so. Correct.
Correct.
So that is what is real donation, in my opinion, because here what we are doing is we are donating to our family members. Which is in one way we are just doing a favor for our own family. Donation doesn't mean that we will be how we are terming it as an organ donation. Sometimes I feel this is not a real organ donation when we are talking of living organ donation. Yes, after the brain death, that because nobody knows where the organs are going, that is real donation, which is being taking place by deciding factor is the family, not the donor, not the brain dead person. So don't you think that we in India, we also require some model which are being adopted in UK and in USA, so that we can start this thing with, although we have already approached to the government and we are trying our best to see to it that here also we must get best of opt-in and best of opt-out systems, whatever the best practices, and come out with a third option which will give the benefit to the public at large. What do you say about that, Mr. Mistry? And I appeal to my fellow members, please keep your questions ready, or any doubt or any suggestion you want to give, so that you can interact, because this is something which is very, very important. Because we know why, wherever I go, people ask me, why in India? What is the reason? Why you are talking about organ donation only? My only one line reply is, please compare with UK or US or any developed country of Europe, and you will find the people are not dying there. Very few people are dying. So Indians are also human beings. We are not mosquitoes or something. We are also human beings. When we are human beings, there is a lacuna, and the lacuna is because our legal system, our permissions, our financial things are quite different than other countries. If we will adopt the best of them, then I am sure that Indians are also, many lives can be saved. Yes, Rotary and Mystery.
Yeah, so I think going to your question around sharing and developing systems, I know from the Mohan Foundation have had an MOU with the NHS Blood and Transplant for a number of years, where they were sharing good practice, but the good practice was very much based on clinical interventions. So the special nurses of organ donation, which we have the system of, they're the ones who at the time of donation will have the family conversations. So there's been work around training staff in hospitals or sharing work around from a clinical point of view, but we've not done. Oh, I don't see the Mohan Foundation, who is a great organization in India, maybe working with them and getting uniting Rotary clubs for organ donation to develop, as I said, the campaign that we mentioned, because they do have the evidence, the research that some of our clubs or some of us will not be able to get. And secondly, we can't just rely on one NGO or one Rotary club. We've got to look at how do we influence the ministries, in each of our countries, because ultimately they have the power as well, and they're the ones that we need to. Sometimes we have to change policy recommendations or develop policies to ensure they can be implemented, and so I think we have to tackle this from grassroots and upwards as well, not just relying on the top down from the governments and the institutions. We've got to join up the efforts, and one thing we need to do better at is have a joined up approach where we work in a united way, and that's the key. That sometimes a lot of NGOs develop some good work. They are doing it in a silo mentality, so that's what we need to try and, how do we bring all of this together and have one united, and what better way to do it through the Rotary Club of Organ Donation International and other Rotary Club of Organ Donation, because we are all having a common goal in terms of spreading the message of saving lives. So, Rotary, I think that's where we've got to start looking at gathering because when we try and influence policy or when we try and influence decision makers, that's the first thing they ask is, where's your evidence? What research have you carried out? So we have to be ready and armed with that to be able to then start the campaign that we were talking about earlier.
That's true, Rotary and Kirat Mistry. And when you are talking about, you mentioned about Hindus and Sikhs and Muslims initially. The problem in India, which as a Rotarian or as a organ donation crusader, I personally feel is the first question which the students or even the grown-ups ask: our religion, the reason. I'm sure, because I remember that I addressed the Hindu Council UK, which you organized at Southall, London, and there also the same thing was there, that there is a discrimination between the natives and the South Asian population there. In India, the same question asked here, and they say that our religions are not favoring us. How you are seeing for this, that religion, although as you have mentioned in your opening remarks that no religion is barring about the organ donation, they never say no to organ donation. But how you are convincing the populations, the Hindu population, Muslim population, or the Sikh population who are residents in UK? Rotary Muslim.
So again, we did a lot of lobbying and campaigning to our NHS Blood and Transplant, to the Department of Health, for the last 7 years, we've created a funding pot called the Community Investment Scheme, and again that funding pot started off from £100,000. It's now gone to 1.2 million, I believe, and this is where community organisations, NGOs, can put an application. If their application is successful, they want to develop a campaign or project to work with different communities. So we've got over the last five years, a number of community-led initiatives. Some were faith-based, some are, looking at how we address an awareness of organ donation. So we've got all these reports and projects. That some projects did it through radio, some did it through videos, some did it through plays. So we've got some good practice that we can, share of what's worked and what hasn't worked. But until the funding pot is only we have too many organizations applying who don't get the funding because the pot is so small. So our kind of focus is to ensure the pot keeps growing and it's sustained in terms of not just 1 year initiatives, but 3-year initiatives. So that's what we can share some good practice from the UK context around how we work with different faith communities. The reason why we developed the faith campaign of Hindu, Sikhs, and Muslims against campaigning for embracing organization was because that was the objections I was coming across when I was trying to do awareness in the community. And it was only then getting the scholars to deliver the message from those different respected faiths that people started to listen. And then further getting people who have gone through a transplant or donated from those different faiths as the kind of champions. That was the way of trying to tackle the ignorance or the kind of taboos or misinformation around organ donation and religion or cultural challenges as well.
Okay. Yeah. Any question is coming? Otherwise, again, I have to put something to Rotary and Kirat Mistry. Yes.
I want to know that how are recipients matched to donors? Because here we cannot give to anybody, for outsiders. They are giving. So how their recipients are matched to donors? I want to know that.
Okay.
How they will conclude.
So a recipient is waiting on our register.
For outsiders, for the outsiders, non-relatives.
Yeah. So this is what happens: is if you're a recipient needing a kidney, for example, you are. If your loved one can't come forward to become your living donor, you as I mentioned earlier, you can join a swapping scheme. But there's the waiting list of the transplant waiting list, and that is where people would be then offered a deceased donation when it comes available. It's hard for a loved one or to a relative to say, I want, when their loved ones die, it's hard for them to say, I want it to go to this faith or I want it to go to this person. We don't have we have the law, which is what we've got to work with, and that's how we work. So once somebody dies, the organ, if the family has consented, the organs can become available, and then they will then be offered to people on that waiting list. I hope I answered your questions.
Then who is responsible for the cost of the transplant surgery there?
So we have transplant centers, and
they will take care.
The hospitals will have to take care of that. From the time that the recipient is matched, or gone through the process. If it's a living donation process, then the person coming forward as a living donor is matched through a series of not just medical blood tissue type, but also psychological questions to ensure that the person donating is not doing it for a monetary factor, and the legitimacy of the connection of that person coming forward to that person, is it that's what they match. It's part of the questioning process.
Yeah, Rotarian Sudhir Saran wants to ask.
Rotarian Kirit, thank you very much for making our time to be with us. And the issue which has been troubling me for quite some time is there is a huge gap between the need of recipients and the willingness of the donors for different organs. We have been struggling with this for a long time. There are organizations which specialize in solving resistance, internal and external, to participate in organ donation. So do you think we can have a partnership between organizations in different countries to address this problem can there be international campaign to address this gap between the need and the willingness of the donors? Do you think it will be practical for us to think of a coalition of different organizations? Is it possible?
So it's a good initiative, and if we can develop that, I think it's going to be worthwhile doing. It's just how we convince the right decision makers, the right organizations to collaborate, because there is still, as I mentioned earlier, there's still mentality of we do things in silos, and we want people to do things for egotistic kind of recognition, as opposed to the good cause for the human being. So I think your question is great, and I think if we can start looking at a coalition of we've got organizations who could do that. We just need to start to get them on board. And I think one way of what Rotary Golab was saying at the start was really, how do we start a campaign to influence a Rotary? And once we get the Rotary on board, which we are doing through our clubs, we start to get the governments, the ministries, and then the NGOs to work in a coalition way.
Yes, and I think our MOU, which we have signed among Rotary Club of Organ Donation International and Rotary Club of Organ Donation UK, is one step forward in this direction. And I'm sure what Rotarian Sudhir Saran, who is right now in USA, is saying that we should get the like-minded cooperations from the different corporations and the countries and the communities. Thank you very much, Rotarian Professor Dr. Sudhir Saran. Before I will go to Rotarian Deepan Shah, although he's driving in USA, he's based in USA and he's a tissue transplant expert. Very recently, one bill has been introduced in USA for giving $50,000 tax credit to a donor, a living donor, or the donor whose family is donating for the after the brain death. Similar type of scheme was done in Odisha. That the then Chief Minister, Mr. Patnaik, has given 5 lakhs rupees to the organ donor's family. Although there were lots of objection, rather I also objected, because it's nothing but an inducement. But do you think a country like USA, although bill has not yet passed, there are plus and minus points or discussions are on, do you think such type of monetary thing will give a boost to the organ donation campaign? Keeping in mind the UK thing in mind, because there, like what Rotarian Hemlata has asked about the money part, everything is free there. If you are a UK citizen, your health is totally free, whether any surgery, whether you are indoor, outdoor, whatsoever it is. It's covered by the government. They are charging the tax, like we are paying income tax. There is a scheme called National Health Security, NHS, which is very powerful. Although there are lots of criticism is there, but still everyone is totally free there. So there is no problem as far as the donation or recipient is concerned, which is a very grave concern in India, because here the lung transplants cost approximately 1 crore rupees. So you can imagine the condition in India, how to get the 1 crore rupees to get the lung transplant, then afterwards the post-operative care, etc., etc. So do you think that this type of, and then I will take Rotarian Deepan Shah. Or Rotarian Deepan Shah, would you like to add in this particular controversial bill which has been introduced in USA only for giving a tax credit of $50,000 for the donor's family? Please unmute and you can add on this, then we'll take the views of Rotarian Ministry. No, I think you are driving, so it's not possible. Please concentrate on driving. That is more important. Yeah, we do not want you to take a chance. Yes. Okay, so you please go ahead, Rotarian Ministry, about this.
So it's good if it gets passed, because I think it's, but I think they also need to look at who should benefit from that as well, because people's poverty, if people are who are in low-paid jobs, there should be some sort of criteria to be able to ensure those who need it get it, and not, open to all. I think that's my particular view on the credit. Is, although we've got to be careful, is that that's why in the UK we can't similar sort, when people are coming forward, the monetary aspect isn't not the focus. It's really to ensure that the person doing it, there is a monetary focus because it's going to save the NHS cost for keeping somebody on dialysis as opposed to getting a transplant. That's what we need to focus and the evidence based on. But if the bill is passed in the USA, that could be an opportunity that other countries can look at that and see why it was successful or why it's been passed and introduced. But I think, in certain India, where you've done some good work in terms of trying to get, the Prime Minister Modi is really championing and endorsing organ donation, and through the health insurance schemes that have been developed, we've got to take that one step further and looking at, in each state, there should be, monetary funds created to help those families who can't afford to meet their cost for transplantation or medicine to be able to get that. So we've got to start doing it in different states from the Indian context, but from a global context, where this is where I said, if USA, UK, and some of the richer kind of nations who have, an opportunity to raise funds for, the causes in India and other, countries where there's a poverty challenge, this is what we could be doing to unite that.
Okay. Thank you very much, Dr. Kamal Jain. Would you like Rotin Deepan Shah? Are you there? Can you ask the question, or you are driving? So we will give more time to you.
One small question, sir.
Okay.
Is it possible?
Sorry.
One small question.
Yeah. Please go ahead.
Sir, I can understand it is free there in UK. Just I want to know, will being a declared organ donor, that is to donate after my death, it affect the care I receive in the hospital? Will being a declared organ donor, to donate after my death, already I've declared that, it will affect the care I receive in the hospital. They will take care or...
Yeah, okay, good question. And this is some of the myths that we are trying to address, because people that have still the myth that, your loved one's body is going to be cut open and the organs are going to be taken without consent, and the surgery that the body will be then given back to the loved ones to then have their funeral rites observed. This is what we've had to go through in terms of making sure these myths and misinformation is being addressed. You can't, from the UK, when a transplant, is going forward, that we have special nurses for organ donation, and I mentioned, which is part of the NHS blood and transplant team. They will have the first conversations. When somebody's dying, they will have the conversations with their families to say, would you be happy to go for, your loved one is an organ donor, and would you be happy to honor their wishes? And then once the family give consent, or the next of kin can give consent, then the process starts. But if the family say no, or if the next of kin refuses, then no organs can be taken.
Yes, and this is the same system in India, although it's an opt-in, like UK now is opt-out, but here the permissions or the taking care, because no one can take out the organs because there are so many checks and balances now with the law, and if you are doing anything illegal, then though you can do anything, you can loot or find one bank also, that is a separate thing. But when you are, it's a legal system in India, very, very strict system. No one can take out the organs without a total legal way. So thank you very much. Now I can see Dr. Rotary and Dr. Kamal Jain. Rotary and Dr. Kamal Jain is very active for this organ donation campaign. He is the head of the organ donation campaign of Giants Group, and they have about more than 600 clubs under him. He is coordinating with them, and recently he has joined our club. So welcome, Rotin, Dr. Kamal Jain. I can see you are also in the car. You are also, I am sure you are not driving. If you are driving, or so.
I have parked my car.
Okay, very good. So and you can ask the question, Dr. Rotary and Dr. Kamaljan.
Hello. In India, for retrieval, hospitals needs license, and that is one of the issue because of which the donors are not ready. Because to retrieve sometimes the body has to be taken to around 100 kilometers. Now the same thing is in UK, or all hospitals are permitted to retrieve the organs.
So we have transplant centres across various UK regions, and that's the kind of basis of, depending on where the organ becomes available, and once they match on the register, the transplant centres who has got the priority of a children, as I mentioned, who is needing that organ, they would then get it, and that's kind of how the system in the UK works through the transplant centres, where they would then be offered that organ and then delivered to those transplant centres according to the transplant waiting list.
Rotary Kirat Mistry, what Dr. Rotary and Dr. Kamaljan wants to know is, like in India, very few centers, whatever centers we have, mainly are concentrated on metros or big cities. There are many areas, rural areas, where is no, even forget about transplant center, retrieval centers. Now, then it is very difficult to bring, even for the tissue transplants, forget about organs. So, what he's asking, what is the condition in UK? Every district or revenue district, you have the transplant or revenue centers, or still a person has to go 100 miles for the donation, or everywhere it is available in all the districts or the cities?
Yeah, so as I said, we have UK transplant centres across England, across Scotland, Wales, Ireland. So based on those transplant centres, some recipients may need to travel some distance, but mostly very, very few would have to, because the transplant centre dealing with that recipient would be then closest to them, and they offered that organ when the deceased donation needs to take place. So when the deaths happened, the transplant centre would be then they would deal with it, because the hospital where the person's being kept alive on the ICU, where they're being kept alive in ICU, they will then know that this organ is going to become available. They've consulted the families, and then the transplant centre would also be notified that an organ will be available, and then they will reach out to people on the waiting list to get that.
Okay.
Hope that's clear.
Any follow-up question, Dr. Rotary and Dr. Kamaljan?
No, thanks, sir.
Okay, thank you very much. Rotary and Deepansha, now will you be able to ask the question? Or is still, because you can't unmute? Okay, you want some more time. Okay, no issues. One thing which what Dr. Kamaljan has said, I just want to know from you, in UK, you have a mobile transplant centers, like having a operation theater in a truck, and it goes to any hospital, primary hospitals, or the medical centers anywhere in the remote area. They plug it, and then they will do the transplant, and then they shift it to the either to the city or something like that. Is it possible there? Is it happening there?
No, because I think our hospitals are well equipped to carry out, and we have so many hospitals in one area to be able to then who are doing transplants. So that's where they would be going. So if it comes to a rural area, they would just make allowances for people to travel to that nearest center.
Okay. One more thing, like in USA, they say that they are getting more organs from those elderly people who are almost going to die, and the doctors declare that they will not survive more than 6 months or so. So they were kept in the hospice and a special type of the nursing homes, where the trained nurses who are just giving the comforts or the painkillers, no medications, nothing. So the patient can die peacefully. This is a very common thing in USA. And then they were they feel that, okay, so much comforts we are getting, why not we donate our organs? So it is happening in USA. The organs rate of organ donation is increasing bit because of this. UK is having such type of systems.
Sorry, just the last bit of the which system are you referring to? Sorry, I missed it.
Hospice, where is Rotarian Sunil Gupta? Are you there right now? Rotarian Sunil Gupta, if you are there, because he discussed with me and we were discussing whether it is possible. Sunil Gupta, if you are there, please unmute and enlighten us about the hospice, and then we will ask the question. You can ask the question.
Yes, I'm here. I just had a discussion with Rotarian Lal Goyal about the concept of hospice, which is when no other treatment is available, patients are referred to a system called hospice where they are kept comfortable until they pass away. I am not sure whether that has anything to related or to do with the organ donation, but that is just another thing which is to make sure the patient that can't get any other treatment possible to extend their lives have a way to be comfortable and not suffer pain, and be kept comfortable. I don't think there is anything like that in India, and that was the discussion. Again, as I said, I have no idea. I'm not an expert in this to know if there's any relation to organ donation, whether people are asked for donating their organs if they are in hospice.
Okay, so we have hospices, but mostly they are for the end of life care for people who are going through cancer predominantly, and those they specialize in making that patient comfortable towards the end of life. They also have obviously some families decide the end of life care, they don't want it in the hospice, they want to do it at home, so there is the option of doing that as well. But from organ donation, of a hospice around organ donation, we don't have that, which is quite an interesting concept, really, because it's if we did have something, maybe we may see more donations coming forward, because the education and the awareness would be raised. But again, it's a good. We've got it in the UK, but mainly related to cancer end of life care.
Yeah, and especially at least the tissues can be donated, if not organs, because like eye cornea or the skin, because the patient knows that he or she is not going to survive after that time. So he or she can declare and decide, okay, I am donating, and that time the last wishes of the patient I am sure it will be honored. So that's what I was exploring with Rotarian Sunil Gupta, why not we can have such type of thing in India, although India is not allowing the predetermined death of a person, but still something can be done where the patients can, because the care which they are getting in the last phase of their life, painless death is also very important. So thank you very much. Any other questions left, or anyone want to ask any questions? Please feel free to ask questions. Okay. Now I would like to announce here one very interesting thing today, that Rotary District 3141, where we are the part, are ready to provide free cornea transplant to a needy person. So if in any of your city, wherever you are, if any person who is blind, who is a needy person, either he can come to Mumbai and get the free transplant done. If they want to do in their city, they have to contact either the Rotary District 3141 or to me. I will, being a committee member in this, I can talk to them. I will see to it that somebody, a doctor, a transplant doctor in that particular city, will take care of it. And the payment, there is a fixed amount which Rotary District is paying in Bombay. And they say that this is the amount which can cover the transplant easily. They will be sending to that thing. So it's a very good development is taking place, and I'm sure that at least the eyes transplant can take place, and many of our members who knows the persons, because the problem which the district 3141 is facing here is that the real blind people or who are needy, they are not coming forward. So if you know anyone, whether it is in a Thane district or in UP or Bihar or Karnataka or Tamil Nadu, wherever, just let us know. We will get it done. So that is one more thing I would like to say. So I don't think that anything else left or anyone else want to ask anything. Otherwise, I have to ask our first Rotarian, Dr. Gautam Goyal, to extend the vote of thanks to Rotarian Kirat Mistry.
Thank you, Rotarian Lal Goyalji, President of our esteemed club. On behalf of the club and our President, I would like to thank Kirat Mistry ji, who took a valuable time out from his work, and he was available for this Zoom meeting. Ours is a very special club, sir, in which all the members we get together. We are from all different parts of the world. We all have our different thinkings, experiences, but we have no boundaries. So that is the real positive part of this club, where everybody has something to share. It was very good to hear today there are problems everywhere in organ donation and receiving organs, not only in India, also in the UK. But that also strengthens our belief that we should work together or find ways to work together. Because if we work together as a team, definitely we can make a positive change in society and leave the world a much better place. Once again, I would like to extend our thanks to Kirat Mistry ji, and on behalf of the club, I would like that again and again you are part of our club meetings whenever it is possible. And if you require our support, our help, anything that you require from us, we will also be with you shoulder to shoulder. Thank you.
Meeting is hereby adjourned.